Good health.
That means Dr. Manny is joining us.
And Dr. Manny, always good to have you with us.
How are you guys?
Well, we're doing pretty good. We want to talk a little bit about this problem that a lot of people have. Dry, itchy eyes.
It's a big problem. 1 in 5 Americans have dry eyes. So for a lot of people, this is a big problem because you don't make enough tears. The eyes are not lubricated. So if you're using drops 2 or 3 times a day, check out this new technology. You're going to like it.
They're gritty, like there's sand in underneath my eyelids. They burn every now and then, as I say. They get tired, and sometimes they're red. And it's generally uncomfortable.
And Susan isn't alone. 1 out of 5 Americans suffer from dry eye syndrome, a condition that occurs when the eyes do not produce enough tears or when the tears do not have a normal chemical makeup.
Definitely one of the top eye conditions that we encounter. And it's so important because it is very critical for the best vision.
People who have had LASIK, refractory, or cataract surgery are at risk for dry eye syndrome. Contact lens use and some medications can often dry out your eyes too. Lubricating drops are the most common treatments for this condition, but can also become a chore for these patients.
It's annoying to have to keep doing it. I don't want to have to stop and worry about putting drops in my eyes.
But Dr. Coad says when you're using drops more than 4 times a day, it's time to consider other options.
We have punctal plugs, which keep tears on the eye. We have certain non-steroidal anti-inflammatory drops that are relatively new. We often will recommend omega-3s, which help your lipid production, and now, lately, the IPL.
Intense pulse light therapy, or IPL, has been used to treat acne and other skin conditions like hyperpigmentation. But now this technology is helping patients like Susan get rid of their daily drops.
What we're doing is applying it to the area right below the eyelid and then to the lower eyelid, closing off some of the vessels, the telangiectatic or microvessels that you see, and they can be very prominent in people that have rosacea. But by closing off some of those vessels, we think we're decreasing the immunomodulators or some of the chemicals that contribute to dry eye.
You know, also the heat of the light acts as a warm compress in the oil glands, making more fluid, which is very advantageous in these cases. The thing is, you have to have about 4 treatments, at least 4 times in the course of a month or so. So it's, you know, you have to have multiple treatments. But talk to your ophthalmologist. This could be a great option for folks out there.
Absolutely. If it works, it's a great
people.
commitment.
Got it.
And most people are good candidates for this.
Very good candidates for it.
Not expensive? But insurance gets involved too, right?
I don't know. I don't know about that. Okay. You know, it's always about the money with you. Okay.
You speak like a
Hello,
doctor.
sign of the times
Thank you,
right
Manny.
now.